engaging the community since 1970. This is WIS Awareness.
Good morning. Thanks for joining us on Awareness today. I'm your host, Leland Pinder. And coming up in April is the second annual South Carolina Survivor Summit put on by the Hive Community Forum. And the executive director of the Hive joins me this morning. This is Ashley Thomas. Thanks for being here.
Thank you for having me, Leland.
Glad to have you here. This is a big event for you all, your second one. It's getting bigger and better every year. And you all really work to prevent and cope with those who have experienced sexual assault, sexual violence, and that's something that is definitely prevalent in our community, and you're working to fight it. So tell us more kind of about this summit and how this all came together.
Absolutely. Well, before I talk about the summit, I want to talk just a little bit about the organization. And so the Hive Community Circle, we were established and started in 2015. And as you said, really to be able to not only provide prevention so that we could help to decrease sexual violence as well as intimate partner violence, but also begin to provide support for specifically underserved survivors and those from low-income and marginalized communities. And so out of that, what we saw was a greater need to be able to provide services in a way that we're going to meet survivors where they are. Because as a survivor myself, one of the things that I know is that oftentimes in working with survivors as well, isolation, embarrassment, shame, those are a lot of the factors and things that come up that survivors deal with after the trauma. And so the summit came about to really help establish community for survivors so that they would know that this is not a journey that they have to walk alone, that they would have that peer support, but also support from the community to know what might it look like if I was to decide that I wanted to, begin this journey of healing or just continue to work on myself, because healing is fluid as we know it. So
why is it so important for your group to kind of help that group of people who might not have the resources or money or what have you to kind of get access to those more prevalent things that are out there?
Absolutely. That's a great question. So one of the things that there's always intersections with things that make individuals more vulnerable to experiencing sexual violence or intimate partner violence. And that could be poverty, that could be violence already within the home, living in an area where there's low performing schools, or there's a one parent household. And so there are other factors that go into play. And when we talk about certain communities, African American communities, particularly women, are sexually assaulted at a higher rate than other ethnic groups. We are also, for every one, there are 15 who do not disclose that they have experienced some form of sexual violence. And
why is that? So why are black women more likely to experience this, and why are less of those women likely to report it or seek help for it?
I think a lot of it goes into the stigma. There's stigma associated and attached to sexual violence in general, regardless of what ethnic group you are a part of. But there are also cultural practices and reasons that, oftentimes within certain communities, it's, what happens in this house stays in this house. And you're taught not to talk about these things. There's also the historical, going all the way back to slavery, that this was something that was done to black women, and you had to be kept quiet, because if not, you were risking your life, your spouse, or your children's life. But then it's also when women of color, not just black women, have gone to disclose and seek services. Unfortunately, oftentimes they're not believed. Oftentimes there's victim blaming that happens within the system as well, unfortunately, towards women of color as well as those that are from low-income communities. And so it really takes, again, providing services that are culturally specific to speak to those needs.
So this summit, again, it's your second one. Just tell us what's going to be happening. What can people who attend experience and see?
Absolutely. So the summit is April 12th and 13th at Adventures Children Museum. And on April 12th, that day is for professionals and community members, those who may work directly with survivors, or those who may not work directly but interact with survivors every day, whether that's through the education system, healthcare, criminal justice, And so that day we will have one of our speakers is Dr. Valerie Ekway from the South Carolina Coalition Against Domestic Violence and Sexual Assault, as well as Megan Plasmeyer from REN. And they are going to be doing a session to really update those that are working in the field around what are the current trends, what are the current statistics, but what are also the barriers to service? What are ways that we can improve the work that we are doing and better serve survivors? And so there will be the opportunity for those that are present on that day to be able to strategize and come together so that we can look at ways that we can collaborate to better serve survivors.
Okay, we'll pause right there and take a quick break, and more with Ashley and someone else who has survived these kinds of experiences and is now working to help others going through it.
You are dancing with your heart open.
The junior duels really take off.
I could not take my eyes off you.
It was everything.
And soar to new levels.
Battle ballet. Work.
I didn't know you had that in you.
World of Dance, new tonight on NBC.
You trust me?
God, no.
That's good.
What has gotten into you?
Gang friend.
How was it?
Good Girls, tonight on NBC.
No one wants to be in a car or truck accident. They can lead to large medical bills, physical therapy, surgery, and lost wages. I'm Carl Solomon of the Solomon Law Group and the Legal Minute on WIS. If you've been hurt in an accident, give the Solomon Law Group a call. The best time to hire a lawyer is before you give a statement to an insurance company. Not getting help first makes it harder to get you proper compensation, and the consultation is free. Give us a call, 803-900-9000.
With the legendary power of real steel, projects happen easily. Achievements happen quickly. Real pride happens instantly. Lightweight battery-powered trimmers start at $129.95. And right now, save $30 on the reliable FS91R gas-powered trimmer. This season, make it happen at your local steel dealer. Search STIHL or visit steeldealers.com.
George Sink fought for our country, and now he fights for you.
U.S. Marine George Sink went to battle for me, and I know he'll go to battle for you.
When I found out George Sink was a Marine, I knew he was an honorable man.
Just call all nines now.
George Sink fought for me. He cared for me.
George Sink is a Marine, and he knows how to fight.
I fought for my country, and George Sink injury lawyers fought for me.
If you need someone to fight for you, call former Marine George Sink.
Get George Sink Law Firm on the line. Call 999-999.
Soon, all of this will be Centennial Park, a beautiful landscaped park that enhances the lives of those who work, live at, and visit Fort Jackson. Centennial Park will be a welcoming place for families, graduations, military events, even weddings. And you can help the Gateway to the Army Foundation build a park by purchasing a commemorative brick in honor of a loved one. To learn more, go to WISTV.com/veteran.
Year of the Veteran, sponsored by All South Federal Credit Union and Bathfitter.
Welcome back this morning. Still joined by Ashley Thomas, Executive Director of the Hive. And we're also joined now by Candy Posey. And Candy, you are a survivor of sexual assault and intimate partner violence. And now you also work with the Hive in all their work that they do to help people who are also experiencing these things. So real quickly, tell me what you can about your experience and how you moved from that to where you are today, doing well and trying to help others.
So I started a group called Beyond Yesterday where I assist women in overcoming their past. And my niece actually introduced me to Ashley. She thought we would be a good fit. And I really saw her heart. And I saw what her organization stood for, and our missions aligned. So I said this would be a good fit for me. And I just believe that the things that God put us through or that we go through in life, we're there to serve others. And so I use my experience to help women and to serve them and to let them know that they're not alone. And it's not something that we have to go through alone.
How long did it take you to kind of get to that mindset? Or what did you have to do in yourself to get from being a victim of this kind of violence to wanting to help others and share your story?
So the funny part is I never saw myself as a victim, right?
A survivor of this kind of violence.
Yes.
Yeah.
Well, even a survivor, because it was just something that happened. So we just go through. We don't even realize that we've experienced trauma. So I didn't put that name to it. And then I just started I started thinking and just going through life and experiencing. And as I met other women, I was like, you know what? This has happened to me, and this did affect me. I didn't even realize how certain things affected me until later. And I think I was in my 30s before I really found my voice again.
Wow. So now, with your involvement with the Hive, you're a volunteer, but you might as well work there. Tell me about all the things you're involved with. You lead certain groups and whatnot.
So we have a group called Queens Gather, and we work with the women. I know we have others, and we work with the youth, but we work with the women, and we meet bi-weekly, and it's been a real blessing to see the growth in the women in Queens Gather. We teach them things like self-care and recentering their voice and advocating for themselves. So we get to witness them grow spiritually, emotionally, physically, financially. So it's been a real blessing to see that.
Now, this is something that affects men and women, but certainly women far more often. And with the summit coming up, it's a 2-day event, and the second day of the event focuses largely on women and those who identify as women. So there is an LGBT community component to all of this. What are some of the differences, or are there any differences in reaching out to those survivors of sexual assault and violence and getting them the help and resources they need?
You know, I believe that's a great question, Leland, and I believe it's just important to ensure that they have a space and a safe space to know that their voices are heard and that their experiences are honored and recognized. And that's really what it was about. And so it was very important for us to create a space where if someone identifies as a female, that we want them to be there. And so we have really worked diligently and hard with Sexual Trauma Services of the Midlands, as well as with Vasa, who has collaborated with on this event, to really make sure that we speak to every individual that either identifies as a female or, you know, was born as a female. So that was very important because it's another marginalized community that is drastically impacted as well by sexual assault and intimate partner violence.
And talk to me, are there more people out there like that who need this kind of help than you probably realize? Yeah, absolutely. Absolutely. I mean, you know, 1 in 4 women and 1 in 6 men are sexually assaulted by the time they're 18. And so it's a matter of people really being supported enough, and as a society, us welcoming individuals and believing them when they disclose, that will help and compel more people to come forward. Now, with the presentations at the conference, that's one element of it. Right. But also, you're leading a conversation at the conference. In addition to the Queens Gathering you mentioned a second ago, what's your panel going to be on?
So our panel is on healing and the journey through healing. Okay. And what will that involve? So each panelist would just really share their experience and how they healed and what that's been like. Not really scripted, just really sharing our heart and our journeys. Right.
So just an open, just conversation, therapeutic kind of approach.
Yeah, and really what it means to be in control of one's healing. Because as survivors, the one thing that's been stripped away from an individual was that their own level of control and power over themselves. And so what does it mean for, you know, to lead your own healing? That panel is going to be actually moderated by Whitney Sullivan. And we have Miss Yolanda Smith, Marcus Lattimore's mom, who is going to be on the panel, who's a survivor of intimate partner violence. A lot of people know Beezy Baby, Katera, which is a local artist. A lot of people don't know that she was in a very toxic relationship, and one of her songs that people love, Superhero, will be a part of, you know, that she'll be talking about that as well on the panel. So,
all right, last question here. I already asked you this, Candy. Same question for you. What did it take, and how long would you say it took for you to get from those experiences in your past to where you are today, starting this nonprofit and helping so many other people? people and wanting to use your story for the benefit of someone else?
Right. You know, for me, I really didn't, the first experience that I had happened when I was very young, and so I actually didn't even remember it and recall it just because my brain from the trauma had repressed it. And so it wasn't until I was an adult, but even understanding and knowing that I experienced, kind of similar to what Candy said, that what I experienced was molestation and rape at a later age. And I was involved in a lot of unhealthy relationships. I struggled with anxiety and depression, and not realizing that that was the root to what I was experiencing. And so when I was about 24, I got counseling, and about 3 years later, you know, I saw through my work as a professional social worker that this was a consistent theme, particularly within low-income communities and communities of color, where the rates were just higher. There were a lack of services. There was a lack of culturally specific services to really address the needs and support survivors in the way and the way that they needed to be done. And so that's really how the Hive came about. We are very much survivor-driven and community-centered.
It's amazing how something like this can follow a person their entire life if they don't seek out the help they need. And that's obviously can be hard to do, but of course you all would encourage folks to do that if they need that help. All right. So again, the summit's happening April 12th and 13th at the Adventure Museum in downtown Columbia. Head to thehivecc.org for more information, or to scsurvivorsummit.org. Back.
What do you mean it isn't covered? The other car was at fault.
Don't scream. Call Akeem. The jury gave us a $2.4 million verdict for our client who was injured in a car wreck. Don't wait. Dial all twos now.
To get your attorney, dial all twos now.
The rule of three states, things that come in threes are inherently more appealing. We couldn't agree more. 3 SUVs, 1 GMC. Current eligible non-GM owners get nearly $10,000 total value on this Acadia Denali when you finance through GM Financial. That's 19% below MSRP on this Acadia. See your local Buick GMC dealers today.
Minutes before it gets to your house.
These are very dangerous storms moving through.
A tornado is possible on the ground.
Hours before it impacts the roads.
Take cover right now.
Days before it threatens. The WIS First Alert Weather Team is there. WIS News 10 Chief Meteorologist Dominus Brown alerting you first to severe weather with the most trusted team in the Midlands to give you a little extra time. That's why we First Alert.
You are dancing with your heart open.
The junior duels really take off.
I could not take my eyes off you.
It was everything.
And soar to new levels.
Battle ballet. Work.
I didn't know you had that in you.
World of Dance, new tonight on NBC.
You trust me?
God, no.
That's good.
What has gotten into you?
Gang friend.
How was it?
Good Girls, tonight on NBC.
WIS 10 in your town is coming to Lexington to kick off Tartan Day South. Join us at the Ice House Amphitheater as we get you ready for the Celtic celebration. Friday on WIS News 10.
I am owner and operator of Bath Fitter. We believe our veterans are the heart of the country and extremely proud to be an Operation Palmetto employer. Please join us in support of 2019 Year of the Veteran.
Welcome back this morning. More things happening in our community to ensure your health and well-being. Right now I'm joined by Tricia Pollard of the National Coalition of 100 Black Women, and this is Rep. Terry Alexander of the South Carolina Legislative Black Caucus. Thank you both for being here.
Thank you for having us.
Absolutely. And you're here to discuss the Minority Health Summit coming up to highlight health issues affecting the black community. We'll start with you, Mr. Alexander. Tell us more.
Thank you very much. Thank you for having us here. This is the Legislative Black Caucus's second conference that we're putting on. What we are trying to do, what we are attempting to do, is to inform the community of some of the issues, some of the ills that are affecting our community, and some resolve to some of those issues that might impact us. So this particular year, we have two panels that's going to be presenting about some chronic disease, and then we have a panel talking about some of the disparity in healthcare and the impact that it has on our communities in particularly. So we're having a lively discussion about the healthcare in South Carolina in general, but in the African American community in particular, because it affects us differently. As we often say that when other folks get a cold, African Americans get the flu, and we are trying to eliminate that flu syndrome that's going around in our communities. And the best way you can do that, we contend, is by providing information. Not only information, but by providing some type of resolve. So we're going to have vendors out there doing testing, vendors out there who are going to be checking our eyes and our ears and just giving us some answers to some of the questions that might be impacting our community. So we're pretty excited about that.
Yeah, so you have several partners in this, including SCDHEC and the Coalition.
Yeah.
Tell me about how you all are involved, Tricia.
So I am the co-chair of the Health Committee for the National Coalition of 100 Black Women. I'm involved because my company, Hummingbird's Echo, is a mobile cardiovascular company. So we bring awareness on cardiovascular health, and our theme as the coalition is to bring health awareness. And so we have partnered with the Legislative Black Caucus because of the Health Summit.
Right, and this is something that you can look forward to seeing at the summit here. There are little coasters here with your website and kind of more about what you do.
Correct.
There at the summit, and you'll have other vendors in place as well. One thing that really affects our community and the whole state of South Carolina is heart disease, and that's something you guys will be covering there. Just some quick information for you from SCDHEC. More than 10,000 people in our state died due to heart disease in 2015, and then more than 50,000 hospitalizations that same year, and it comes at a cost of $3.2 billion. So that's obviously a number you want to bring down across the board as far as costs and the number of people who are dying from this in our community and at large.
Absolutely, and it is important. It is important that we take a look at those numbers and other numbers as well. And it is basically about our lifestyle. So largely it's about our lifestyle, how we live, how we eat, and how we take care of our body, as well as having access to health care.
It always seems to kind of come back to that access
to health care. Yeah, because if you catch it early on, if you are a regular patient, then you'll be able to catch these diseases, catch all of these things that are impacting our bodies. So we're going to talk about those chronic diseases and how we can manage them better, particularly in our communities.
Can I ask you a question about healthcare?
Sure.
Okay, so recently in the news, I didn't plan to do this, but it just seems very relevant. There's talk of just dismantling the Affordable Care Act altogether. And of course, that's something that has benefited all Americans, but particularly low-income Americans and many minority groups. That would be detrimental, I feel like, and kind of counterintuitive to what you all are working to do with this conference.
Let me talk about that just for a second, particularly here in South Carolina. When you're talking about the uninsured here in South Carolina, the majority of the uninsured people in South Carolina are white folk, not African Americans. The majority of the uninsured people in South Carolina, those numbers in the white community are extremely high. So just not impacting African Americans, as some might think, is impacting all Americans who don't have access to health care. And that's what it's going to do. I think it's too interconnected for them just to get rid of it. I just don't see, because if that was the case, it would have been done years ago. They're going to probably dismantle piece by piece, but to just say we're going to cut it off, the impact would be tremendous in our communities, not the communities just African American, in our communities across this country. So it's going to be interesting to see how that's all going to work, how all that's going to pan out. Where people have had insurance, and you're saying now we're going to take your insurance away from you?
And the mortality rate as well.
Yeah, you're taking insurance away from people who had it, and say, well, we don't know what we're going to give you. We'll figure it out. I just don't see how that's going to play well in our American society.
So you, Tricia, you're a nurse by profession.
I'm not. I'm a registered cardiovascular sonographer.
Okay. There it is. Tell me, just in your professional experience and career, how does this affect people that you see in your office, these issues that they're not addressing?
So, first of all, diagnostic testing is not cheap. And a part of preventative care and preventative medicine is to have testing, because there are so many symptoms that go untreated because people ignore the symptoms. They're so synonymous across the board. Cardiovascular health and cardiovascular disease is one of the silent killers, even in African American women alone, one of the highest detriments to us. And so taking away the ability to get this testing and stuff done through insurance is just detrimental to our demographic and to women as a whole.
Right. Okay, thank you both for sharing this morning. Here are the details of the conference on your screen. It's coming up here soon at Brooklyn Baptist Church in West Columbia on April 6th, 8:30 a.m. to 1:30 that day. And I believe it's free and open to the public. So just come on by and get some good information.
And bring a friend.
This is a bag, but for Steve. This bag gives him food cred, because now everyone knows that when they have that craving, well, they just need to follow Steve.
Get a McChicken biscuit or a Chicken McGriddles for just $1.59 each.
At Burger King, the new Whopper meal deals take the crown. Get the Whopper Junior meal for $4, the Whopper meal or the Crispy Chicken Sandwich meal for $5, or the Double Whopper meal for $6. Try the Whopper meal deals, now featuring Crispy Chicken, only at Burger King.
Attention Medicare beneficiaries. If you have or are eligible for Medicaid, please listen closely. You may be eligible for a Medicare Advantage plan from WellCare Health Plans with zero or low plan premium. Call 1-866-907-5952 now. That's 1-866-907-5952. Representatives will provide detailed information and help see if you qualify. WellCare provides access to a large network of local and regional doctors and hospitals. Plus, some plans may include benefits for dental, vision, hearing, Part D prescription drugs, and more. WellCare is contracted with Medicare to provide plans that may be right for you. Call 1-866-907-5952 now. That's 1-866-907-5952.
WIS 10 in your town is coming to Lexington to kick off Tartan Day South. Join us at the Ice House Amphitheater as we get you ready for the Celtic celebration. Friday on WIS News 10.
This is a bag, but for Steve. This bag gives him food cred, because now everyone knows that when they have that craving, well, they just need to follow Steve.
Get a McChicken biscuit or a Chicken McGriddles for just $1.59 each.
All right, want to once again say thank you to all my guests for joining me today, and also thank all of you for watching. If you want to learn more about the Survivor Summit coming up with the Hive, again, head to scsurvivorsummit.org or thehivecc.org, and also the Minority Health Expo coming up, the Legislative Black Caucus, as well as the National Coalition of 100 Black Women hosting that coming up April 6th at Brooklyn Baptist Church in West Columbia. All right, have a great morning. Thanks for joining us.
If you believe